Welcome and thank you for joining us. My name is Hugh Porter. I'm the Vice President for College Relations and Planning at Reed. I use he, him pronouns, and it's just a great pleasure to be here with all of you and to try and answer some of the questions that you've submitted in advance. I'm joined today by a wonderful panel of caring experts, and I'm going to ask them to introduce themselves in just a minute. As you all know, the topic of today's session is health and well-being. And with that, I'm going to turn things over to the panel to introduce themselves. We'll have then some general remarks that in part take on some of your questions, and then we're going to go through some of your specific questions. My hope is at the end, we'll be able to pick up some of the questions that you are entering in the chat session. And I apologize in advance if we run out of time. So, I'm going to go in order of my screen for introductions. April.
Hi everyone, I'm April Sams. I'm the Director of Environmental Health and Safety and Risk Management. I use she, her pronouns.
Carrie.
Hi everyone, I'm Dr. Carrie Baldwin-Sayer. I use she, her pronouns, and I am the Associate Dean of Students for Health and Wellbeing. Thanks so much for being here.
Timmy.
Hi everyone, my name is Timmy Roshan. I'm the Medical Services Director at Reed College, the Health and Counseling Center. I use she, her pronouns, and I'm happy to be joining you all today.
Great, so again, if you have questions that we're not answering, please enter in the chat section. We'll do the best that we can to get to them. We're going to wrap up about 4:50 p.m. And if we haven't gotten to your questions, please email them to the coronavirusquestions@reed.edu and we will respond. So again, coronavirusquestions@reed.edu. So going to begin talking about our overall plans for health and well-being. It's been a fundamental effort of everything we've done at the college for a long time and certainly at this time. So I'm going to begin just with overall expectations for public health with April.
Hi everyone. We had a lot of questions regarding expectations and compliance around public health measures that are on the Reed webpage and everything that we put forward in our COVID plan. Both the college and individuals play a critical role in sustaining the health and well-being of our community. We need the whole Reed community to participate in these safety measures in order for it to work as best as possible. Eventually, we're hoping that these public health measures such as social distancing, face coverings, and hygiene become a community norm. So things such as face coverings being mandatory when you're inside areas or outside when you can't maintain 6 feet of distance. You'll have to wear your face covering everywhere except when you're in your individual dorms with the doors closed, or when you're performing oral hygiene or taking a shower. We'll use 6 feet of distance as our guiding principle to rearrange classrooms, space out bathrooms, provide hallway egress options, and any public spaces that we may be setting up for social interaction and engagement with students, faculty, and staff. We're also going to be increasing cleaning regimen, increasing high touch point cleaning protocols where our facility staff will be going into frequently used areas such as restrooms, classrooms, and hitting those high touch points more often during the day. They're going to also be doing this between classes when time allows, and then doing a thorough deep clean and sanitation every night. And then lastly, discussions around failure to comply and how we would enforce disciplinary actions. This would be including but not limited to potentially loss of on-campus housing, and then removal from in-person learning environments. We know that these disciplinary actions seem drastic for the Reed community, and we just want you to know that these actions themselves greatly reduce the risk to yourself and to the community. And in order for us to keep you safe and keep our community safe and continue our on-campus learning, we really need everyone to take individual responsibility to protect each other. you need to be honorable and you need to be Reed. And I really do believe that we will have really high compliance with all of these measures. I know how Reed functions and how its student bodies is, and I'm very hopeful that we will be able to move through this semester with relatively good ease and high intention.
Thanks, April. Just to add one comment to that, which came up in the chat sections, the classrooms that we're using are going to allow 6-foot distancing. We've measured them all. We've also created 4 outdoor tents where we can have teaching for instructors who want to use those facilities. Round numbers, each student and the professor will have about 35 square feet of space in a classroom. So significant. And yes, there'll be hand sanitizer in every classroom.
Correct.
Response to a chat.
Hand sanitizer, and we'll have individual cleaning supplies put into every classroom where faculty or even students can clean and sanitize their seating arrangement before or after they leave as well.
Classroom windows in Elliott Hall are openable, and it varies what works in other buildings. And all buildings were, well, April will be addressing this later in the program, I should say. I want to get switch topics to testing and contact tracing, something we've all learned a lot about. And I'm going to ask Timmy to pick up that topic, please.
Sure, thank you, Hugh. All right, testing, a lot of questions on testing were received. And so let me just kind of give you an overview of what testing will look like at Reed. First of all, we have contracted with Tempest Labs to be able to reserve testing capacity. If you're watching the news, you'll notice that places that are being hit really hard are really struggling with testing capacity and the turnaround time. So we felt that it was very important for us to early on reserve capacity, and Tempest Lab is offering the capacity that we thought we needed, and is guaranteeing us quick turnaround time on testing results, approximately 48 to 72 hours. And then of course, then there's a little bit of time needed in there for us providers to be able to review tests and get back with everyone. But that's much better than what we're seeing locally, even with our local labs here. Testing results are being delayed as more people are being tested and as community spread of COVID happens. So the testing that we're going to be doing is PCR testing. It's the most accurate so far. Science is constantly changing, and so we're constantly looking at all of the data coming in from other ways of testing, such as pooled testing and rapid testing and even antibody testing. Currently, right now, pooled testing is not available by the FDA quite yet, and antibody screening and rapid testing still has quite a high false negative rate, and so we opted for our PCR testing. Our testing plan. So first I want to just chat a little bit about some definitions. So we're working on 2 different types. So one is screening, and screening would be what we're calling our testing, our move-in testing. Any surveillance testing would be called screening. So those are screenings. And testing would be, the term testing would be used for diagnostic testing or those who have had exposure. So, you'll hear us refer to screening and testing, and I just want to be clear that that's what we're talking about. At this time, Reed is working on plans to screen all individuals coming back onto campus for the fall term. And we're also working on surveillance testing at regular intervals throughout the term, and also to take a look at reviewing. We'll be implementing a symptom tracker, daily symptom tracker that everybody coming to campus will be required to complete before they start moving about campus. And this will give us data in terms of symptoms and and exposure, people reporting exposure and symptoms. It'll give us a chance to sort of review data on the back end and potentially be able to pick up hot spots where we're seeing more symptoms or more reports of exposure, and be able to get those, chat with those people and get them tested if needed. Our testing piece is for diagnostic and for students who are experiencing symptoms, and also those who are reporting close contact with a known COVID positive individual. And we will be able to perform that, so that will happen as needed, as those come up and as needed. Contact tracing. So contact tracing, there's a lot of information going on around contact tracing, a lot of questions, I think, all over the place about it. Contact tracing is one of the most important public health tools that has been used to stop the spread of diseases. And we in the medical field and public health field use it for STI reporting, and then tracing outbreaks for vaccines. Where have people been? Who have they been in contact with? So we are going to work as much as we can, hand in hand with our public health department, which is Multnomah County. And Multnomah County Health Department has plans to connect with everyone who has tested positive for COVID within 24 hours of that test being positive. And they will be asking questions around who you've been, who's been around you, where have you been, what places have you been spending the most time, what about the people you're living with, and then they will work from a plan from there in terms of quarantine and isolation for those people. But we also want to, because I think especially on campus, we actually might be able to get a hold of people sooner than that 24-hour period. And also, if community-wide spread of COVID increases, the county may become a little overwhelmed, and then we can pick up sort of some of the slack for them in terms of identifying individuals who may have been in close contact with someone who has tested positive for COVID. It's very important for everyone. I want to stress this, and you'll hear probably me talk about this a lot. It's very important to work with both of us. So if you've talked to us, you absolutely should work with the health department. It's not mandatory to work with the health department and answer those questions, but it's very important in order to keep our community safe and to help decrease the spread of COVID on campus. One of the pieces that we'll be doing is we have an online platform that is a symptom tracker. So if you answer on your daily symptom tracker that you happen to test positive for COVID, you'll get an email link that will give you an opportunity to be able to put in all of your contacts, both with us and with the health department. All information that you put in there is confidential, and we would not violate that confidence by telling someone we're contacting who was the person that possibly they had exposure from. So yeah, I mean, I think that's it about contact tracing, and be happy to answer more questions if you put them in the box.
Thank you, Timmy. We've really spent a lot of time. This is obviously a very fast changing part of the world right now. And I would not be surprised if we have updates on our testing protocol based on available technology. If folks test positive, we'll need to have isolation and quarantine protocols, and I think Carrie's ready to speak about that.
And I thought, thank you, happy to do that. And I just wanted to clarify a question that I saw. Someone wasn't quite clear on the difference between what a screening was and a test was. A screening is still a test for COVID. It's actually the same test for COVID, but it's done on folks who don't have symptoms. So we call that screening versus someone who does have symptoms for COVID, and that we're calling a test. So we have to differentiate it for a variety of different purposes, but screenings are COVID tests. So we're going to be testing everybody who arrives who will be attending class and working on campus, and that includes folks who do not live on campus but will be attending class in person. So there will be communications going out to the community around scheduling those tests to happen. So you'll hear more about that in the future. So we've gotten questions about what would happen if somebody does test positive. So on-campus students who test positive, folks who are living on campus who test positive for COVID, will be instructed to move to a designated isolation dorm. And off-campus students who test positive for COVID will be asked to self-isolate in their homes. And HCC staff will be in communication with any student on or off campus who is isolating because of a positive test, so that appropriate medical care can be provided. The public health department will also, as Timmy mentioned earlier, will also be in contact with students to begin contact tracing efforts. Meal delivery from Commons will be arranged for students who are in isolation on campus. And students who have been in close contact with someone who has been diagnosed with COVID, they will be instructed to quarantine in their dorm room. So they won't go to a separate space. They'll quarantine in their dorm room or in their off-campus home. And my understanding is that faculty understand that a quarantine is going to be a very real possibility for many students, and will arrange for coursework to be delivered to students in a virtual, remote, online fashion. And HCC staff will be in contact with those students as well to determine if they develop symptoms while they're in quarantine, and then to provide them with appropriate medical care if that becomes necessary. So did any other questions come in that I can quickly address on that topic, Hugh, or should we move on?
I just checked the time. This is such a big topic.
I know.
I think one is how students will be supported if they're in the residence hall isolation.
Yep, and we're gonna get to that too. But we will have meal delivery, and the HCC will be providing telemedical services. That's medical services via video. And if students need to be seen in person, that will be arranged too.
Great. We're going to move into mental health, subject of a number of questions and concern widely about this time. So I'm going to ask Carrie and Timmy to address a set of questions received in that area.
Sure. Timmy, you want me to just go ahead and start?
Yeah, you can. Yes, sure.
Okay. So we've had some questions about mental health services, and in particular, we received a question about students who are living on campus and how their mental health will be supported, recognizing how difficult it might be for students who are needing to remain on campus for everything but essential activities. And I want to really reassure folks that the Reed HCC is going to have counseling available for all students who are living both on and off campus in the state of Oregon. Our counseling services will be delivered via telemedicine or via Zoom or telephone if a student prefers. And then if there are crises or urgent needs, counseling will be provided in person. We'll also be providing a variety of virtual workshops and support groups for students to participate in. But wherever possible, we will deliver those services via telehealth and Zoom, which actually really does improve accessibility for students. But if there is a need for in-person visits, those will be provided. Timmy, you want to address the next question on for students studying online?
Oh, sure. So the question around will the HCC provide telecounseling and medication management for students who are studying online? Yes, we will. We, as long as you are in the state of Oregon, we also have some providers who are licensed in the state of Washington. So Washington and Oregon, definitely. If you're outside of the state, we are able to help you find referrals in the community that you're in terms of medication management support. So yes, we'll be able to provide those services in Washington and Oregon, and we'll help find resources with working with the student for outside of those areas.
We also received a question about how will the HCC change to both keep the staff and students safe, but also continue serving students that may need the HCC for other health purposes. So the HCC folks should be really assured that we have implemented the state and federal guidelines for clinic operations. And that includes the use, as we've already discussed, with telehealth. And we're also going to be having a separate space outside the HCC for seeing patients that have respiratory symptoms. There will be increased cleaning and disinfection of door handles, the waiting room, restrooms, exam rooms. There'll be hands-free and no contact check-in options on your phone. And there will be a requirement that everyone wear masks on entering the facility. And we're asking folks to sanitize and wash their hands on entry. So we are taking extra precautions, and we have sufficient PPE to do so, or personal protective equipment. I feel like everybody knows what PPE is now.
Absolutely. There have been a set of questions that have been coming up in the chat about off-campus housing, and I'm going to actually skip to that section and make sure we address some of those. So, you know, there was a question earlier about how many students do we expect on campus, and obviously we're wrestling with that as much as you are in a certain way right now. We have space for about 800 students on campus, and we might have as many as 600 living off campus. The best numbers we have are very soft at this point, although many people have signed up for residence halls, and mostly those are completely full right now. And we do expect and hope that we can accommodate everybody who would like to live on campus to be able to live on campus, but that's a moving target. So we will have potentially as many as 600 students living off campus. That's about 150 more than last year. So it's not too many more, but so maybe Carrie and April maybe could address some of the questions we've received about the off-campus students.
Sure. It sounds like maybe we lost April's video connection.
Right. April, are you? Yeah, there she is. Hi, April.
Hi.
You're muted. There you go.
Yeah.
You want to take the first one on off campus, April?
Yeah. So like Hugh mentioned, we've had a few questions around off-campus housing, some of them which he just addressed. There's some questions around where will there be different COVID safety procedures and level of support for students who live off campus? And what would happen if an off-campus resident tests positive for COVID-19? So just so you're aware, off-campus residents will be provided with the same tools that on-campus residents will be provided with. So they'll have access to the contact tracing application, the symptom tracking application, and then they will also have protocols that will outline what they should do in their own space for isolation and quarantine. Off-campus residents will also be required to go through the same training as on-campus residents. And if Reed becomes aware of a off-campus resident tested positive for COVID-19, either by the county informing us or by our own internal testing measures, those individuals will have direct communication from the Health and Counseling Center regarding care management, and they can also contact the Reed Care team if they need any further assistance while they're off campus.
We also, the next question we received, can off-campus residents be requested to be tested on campus for coronavirus symptoms during the school year, even if they live off campus? Absolutely. The HCC is available to all students, whether they live on or off campus. And if you have symptoms of COVID, we have the ability to test you at the HCC and to provide you with appropriate medical care.
Okay, and then I guess I'll take the next one. What restrictions for moving about campus will be in place for students living off campus? So are we going to put any further restrictions for off-campus residents that we don't have for on-campus residents? More or less, no. All students, either on or off campus, will have the same access to academic buildings and campus facilities. The only thing that's going to be different is off-campus residents will not be able to access dorms that on-campus residents will be able to. And then access will be granted on a needed basis, where some buildings may have restricted or reduced hours just based off of what social distancing measures we have to implement, while others could remain open and allow for small congregate settings where individuals could meet to do homework as long as there's social distancing practices in place. The college plans to designate those areas where students might be able to use spaces to further their academic study. More information regarding all of this building access is still being determined, and we should be providing information here shortly about what that will really look like.
And oh, sorry.
No, go ahead.
This last question could be really quick. It says, if a student living off campus contracts COVID-19, will they be able to isolate on campus? Unfortunately, no, we can't provide isolation for off-campus students to come onto campus for that. But we will, the HCC staff will provide students living off campus with guidance and resources for how to appropriately isolate in your off-campus residence.
Let me just pick up two quick questions on testing before we hit our next grouping. The tests will be administered, that Reed is administering, will not cost the student. We've contracted with those tests directly, and we have a notification place on our website where you can see the number of positive cases, which is right now 2 since March. So the next group of questions had to do with public health measures, social norms. This is an area I've been spending a lot of time with April on. So April, maybe you could jump in, and I'll, so our first question was, what actions will be taken on the non-compliance of face covering?
Yeah, so I think I mentioned a little bit about this earlier. Overall, we really believe that we'll have a relatively good compliance with face coverings and social distancing. And I really do highly feel like this is our duty in front of you, is to provide that education and that tool. And then once the students and once the staff and faculty have that education centered around why they should be wearing face coverings and why they should social distance, I feel like we will have great compliance. So that's one thing that I know that I've been tasked with. One thing I know that all of us on this panel have been tasked with is really putting education first. We do understand, though, that we do have to have some type of systems in place to address issues of non-compliance. We're going to highly encourage community members to engage with each other whenever possible if you are seeing areas of non-compliance. Students living on campus will have to sign the new housing agreement that outlines these community expectations. And then every community member will have to take the mandatory training that also outlines community expectations and agreeing to these community expectations. And I mentioned education. We have formed a public health group that's really looking at social norms around face coverings and social distancing. And they're gonna implement a variety of educational opportunities around the rules and how they address non-compliance. They plan to use public health ambassadors that will provide community members with face coverings and more education on why face coverings are necessary. Yeah, and so this is an evolving list, and I'm sure as we get closer to opening up campus, we're gonna have a lot of other things that we might want to explore, and I'm open to hearing any feedback or suggestions on how you feel, since most of you are probably students, and how you feel as a student, how you would want to have that interaction with your peer, and where you believe that we could get compliance without having to have a drastic, measures in place. So go ahead and shoot us an email, or myself, if you have any suggestions that we could utilize that we're not really looking into.
We had a question about people who aren't part of the faculty, staff, or students at Reed. We've had a long tradition of welcoming people to the Reed campus. It's part of our public good. And unfortunately, this year, we have just written to the neighbors and to our alumni and saying that we will be closed to people who aren't active students, faculty, and staff. We're working on a system. We have a system in place, but we'd like to expand it for identification, so it's easy for folks to be recognized as community members. And we will have community safety and others making sure that folks understand what's our new procedures at this time. So it will be a very different kind of environment, unfortunately, on campus, but we feel it's necessary and it's been required by the state. April, there was a, go ahead.
I was going to say, there is someone just asked when that goes into effect, and that's on August 3rd. We close campus to the community starting August 3rd on.
Right. April, we had a question about students. We've had many questions on the chat about students leaving campus.
Okay. Yeah, so I know there's a lot of questions about students being able to go pick up groceries or making any type of necessary travel outside of campus, and what that would look like for either on-campus students or even off-campus students coming onto campus. We do not intend to restrict movement from campus, but we will highly encourage that if you're going to leave campus, that you do so in a way that you're continuing to practice your public health measures and practice social distancing, wear your face covering, and only leave campus when it's necessary to do so. So if you need to pick up groceries, you need to go to a doctor's appointment, you need to go to another job off campus, or if you just, need to take a little emotional break for a little while, as long as you keep your circle to yourself, maintain that 6 feet of distance for anyone that you contact in the community, and wear your face coverings, we're really not going to restrict your flow back and forth.
April, we had a question about, the lots of questions of understanding about bathrooms, teeth brushing, how we're going to keep those vital spaces safe.
So I'm sure all of you have heard that we intend to enforce face coverings almost in every situation, except for when you're practicing oral hygiene or taking a shower. So I know there's some questions out there of what that looks like when maybe all of students need to get to a 9 a.m. class and they're all rushing into the restroom, trying to brush their teeth at the same time, removing their masks. So the understanding is that there are situations where you're going to have to remove your mask, for instance, to brush your teeth. And in order to keep yourself safe, you need to maintain that social distance. So you should try to stagger yourself as much as possible when you're in those restrooms. Don't use a bathroom that is full or is really hectic in the morning. Maybe shift the time that you get ready in the morning. Maybe you brush your teeth later in the day or at night. But yeah, really looking out for yourself and trying to maintain that social distance even inside the restrooms, when you can stagger yourself between sinks and pick a less hectic time.
Thanks. April, I had answered sort of halfway a question about air management and ventilation in buildings and classrooms. Maybe you could round out my partial answer.
Yeah, so I'm not the expert of window design, I guess, on campus, but I think most of our buildings, you can open up windows at some form or another. Now, we're saying that, increasing airflow any room that you're occupying is one of the measures you can use to reduce risk of COVID. So opening windows is a great tool, and whenever you can do that, you should do that. We're also optimizing each building's outside air and exhaust system to ensure that we're providing the highest possible air quality. We're increasing our filter replacement frequency. We've increased our filter media to a MERV 13 filtration system. And then these are all in compliance, and we're highly following the ASHRAE standards for air handling filtration. So what I would like everyone to take away from this is that Reed is doing everything we can to increase the air quality in everybody's individual areas. For yourself and for your safety, if you can open up the window, you can open up the door, you can go outside, take breaks once in a while, get some fresh air, you should do that.
Fantastic. Okay, we've made it through a chunk of the questions assigned to our panel. There have been many questions that understandably folks have asked that have been addressed or will be addressed by other panels, but let me move through a couple of questions that have come up. There was a question about a transcript of this session. Not a transcript. This is being recorded, and so people can listen to it again or hear the whole thing if you would like to. There have been lots of questions about the dining hall, which have or will be addressed in other sessions, but maybe since it does overlap somewhat with the facilities usage, we could just say a little bit about that. First of all, Bon Appetit is, which is our contracted operator of our dining hall, will be following all the guidelines for restaurants and food service that are set up by Oregon and which change from time to time. They've gotten very good at this. We've had about 150 to 100 students living on campus, and so they've gotten a good protocol for how to serve the food safely. People will be able to sit down in the dining hall, maintaining social distance, and we will have a very large tent permanently set up outside. This is 8,000 square foot tent set up outside the dining hall in that quad, so people can sit down and eat outside. And we will also have a grab and go service, including software, so that one can order online and have your friend pick it up if you want that. There have been some questions about HCC staffing, and I wanted to say I've actually just this morning was working with Carrie and Timmy on how we could make sure that we have robust staffing in place. So maybe Carrie, you want to say a word about that?
Sure. We're not even just thinking about staffing in regular time, where we actually do have full staff in place for the fall, but we're also doing contingency planning to have extra staff available should we need to have additional medical providers come in. But we are well staffed both on the medical and counseling side going into fall, and I'm very pleased to report that.
Great. There was a question that one item I was needed to talk about was about how we are assessing our ability to implement the plan as we've outlined it. Timmy and April serve with me on a group that we call the Risk Assessment Working Group. We meet regularly. We assess public health in Oregon. We assess our campus readiness. We will be assessing personal behaviors of students, and we'll be assessing supplies available to operate. Right now, of course, the data point we have is the public health situation in Oregon, and yes, we're watching that daily to understand what's going on. We are unhappy about the rising trend, and we again are watching it very carefully. there have been a host of questions about the reasons for which one can leave campus. And I don't know if April or you'd like to jump into that, or if there are no easy answers, I'm happy to to say something.
Yeah, I think I kind of touched base on it. I mean, we ultimately want you to only leave campus when it's necessary. So what is considered necessary might be different from my viewpoint and what is your viewpoint. Right now, what we're really focusing on is basically necessity is to go get a food or a health or safety item, go to a medical appointment, go to a job, and probably missing other things. You know that, and it also, you know, that we have to be pretty flexible with that. And I want to mention that because as our county shifts in different phases, our flexibility shifts in different phases too. Because right now, as a county, we are, you know, in phase 1, where restaurants are open, some outside areas are open. They're looking at that now, thinking that maybe they need to close back and shelter in place. So yes, we understand that there's going to be some needs for students to leave campus. And I really want the students to take responsibility to determine what those needs are. Really decide for yourself, is this a risky situation? Is this going to put me in a higher risk area? Is there going to be people not complying with public health measures? Do I really need to go? And then make that decision themselves. We aren't going to be, you know, monitoring traffic flow in and out. We really need you to do that yourself. There's a really good guidance out there, I believe, that the CDC published of trying to question when you need to go and when you don't need to leave your house. And I think you should just really follow that guidance, how we really played when we were like sheltering in place here in Oregon. That was long-winded.
No, April, that was terrific. Thank you. There were a number of questions about sort of thresholds for operating. So we've identified roughly 5 different levels of operation. So level 5 we've thought of as back to normal. That would obviously be a vaccine would be in place, would be widely administered. We're a ways from that, unfortunately. Level 4 is the level we're planning on operating in the fall, which would be classes offered both in person and online. And the levels below that would not immediately lead to the situation we had at spring, where we really had very little going on campus. But it might be we'd have additional restrictions on gatherings on campus. Another level below that might be that folks would remain on campus and take classes online. And all of this we'd be evaluating as we went with the information that we have from the public health app, from testing, from the Multnomah County, from watching people's behaviors, and for just simply understanding our own capacities to manage whatever is going on, which we do feel good about, but we're realistic that we need to be ahead of that curve and not behind it. So that's how we're thinking about this right now. We have not set hard and firm thresholds. I'm certainly mindful of looking at other places that have made different decisions on when they close and kind of what their situation looks like. We are lucky, of course, in Oregon to have be in a city, to have very good access to healthcare, excellent, in my opinion, county public health advice. And so we are in right now in a fortunate position, but we are mindful that can change quickly.
Hey Hugh, there was a couple questions about on-campus living. Some people were confused if individuals would be in singles, and I just want to confirm that all residents on campus will be living in singles. There won't be doubles for student housing. And then there was also a question about how many rooms we've dedicated to isolation, and I thought maybe that would be a good information for everyone to provide. We have designated a whole dorm. I'm gonna get this number wrong, but I think it's around like 90 rooms, and 90 rooms that also could be triple occupancy if need be for isolation needs.
If it's single, it's about 55, 56 rooms. So
Britt.
ideally, we just want,
I
I didn't even know Britt was here. I was gonna break in anyway, yeah. But about 55 rooms for everyone to have their own room. Yep.
Oh, that's good. Britt Hoover is keeping track of us all. That's helpful to know. I'm trying to see, common room usage. This is an area that we've begun to flesh out in more detail. Obviously, we wanted to think through classroom usage first, and there's a lot of conversation. Oregon, state of Oregon right now has instituted a rule that social gatherings can be no more than 10 people. So that's you and a few friends getting together and hanging out. That's going to be limited to 10. And obviously, you want to keep social distancing. I think official school functions, that would include meetings of your club or group or the Senate or whatever you're doing. We are working on how we're going to open up appropriate spaces for those. And again, I think these outdoor tents, while the weather's decent, are going to be a great option. But I think you're familiar with some of the larger spaces on campus that we have requisitioned for regular use. So Gym 1, for instance, that's the smaller, higher up gym, is going to be used as a classroom. A call auditorium is going to be used as a classroom, and so forth. There will be space for group gatherings, but your just sort of regular social gatherings are going to be more limited. And many of the common rooms that I know everybody really likes to use, those are going to be in many cases too small. So we're trying to think of alternatives so that folks can still have a place to hang out.
Hugh, can I mention something?
Of course.
I'm noticing a lot of the questions in the chat have to do with how students are going to be expected to do specific things. And I wanted to mention that there's going to be a training that all students are going to complete before coming onto campus. And I think that's going to be released, don't hold me to this date, but like first week of August-ish. And that is going to answer a lot of these questions that's coming out. But it's very comprehensive. And folks will have access to be able to go back and do that again if they can't remember or look at it again. So I want to assure people that they're not going to be just expected to know things on campus. We're going to really provide folks with the tools that they need to do this well.
Well, we're just about at time, and I want to thank everyone for showing up and being here. I think it's one of the most important things we can do right now is pay attention. To the parents, I want you to know that I sat on the other side of this screen about an hour ago with my daughter's college, so I am enormously sympathetic to your thinking. And students, I really look forward to seeing you back here, and we're working hard to make this a great experience and a safe one. And I want to thank my panelists with whom I get to work with every day for their expertise and their great care for everybody. So great to see everybody, and we look forward to answering your questions online later. Thank you. Bye.